All right, folks, welcome. This is day 2. We've had 4 very interesting presentations yesterday already. Okay, welcome to all of you watching in cyberspace as well on the live stream. Okay, before the presentation, and I announced to you our guest to the left of me, who doesn't need any more introduction, I guess, it's a very familiar face to all of us. But before I do, I just want to go through 2 seconds or a couple of minutes actually, the theme for this year's festival. So this year's Social Science Festival theme is identity, okay? And why identity? For various reasons. We're looking out in the world, locally, provincially, nationally, globally. There's some trends or patterns, right? Rises in populism, rises in identity politics, concerns, crises, violence, injustice against women, indigenous groupings, visible minority groupings, groups, linguistic groups, LGBTQ 2+ groups, okay? We can add to that, obviously, environmental crises and environmental and climate change, urgencies or emergencies, right? And obviously, for today's purposes, we can obviously talk about the pandemic, which is far from being over. We sort of, have one foot in, one foot out, right? And why am I mentioning all of these things? Well, it's very simple. All of these notions could link somehow to the theme of identity, right? Because identity can be one of 2 things, or possibly even both at the same time: polarizing and unifying. All right, so it could be divisive, it could divide people, but it also could bring people together. So, unfortunately, what we tend to see more often these days is identity being instrumentalized and used to divide or to polarize, as opposed to harnessing its unifying capacities or capabilities, right? So I thought it would be a good idea to take pause, right, and reflect about, how we could redirect, right? How we could think about, getting identity back into, the corner where we use it, or it's instrumentalized as a unifying force as opposed to, a polarizing or divisive force, okay? So this morning, I feel like I'm in my kitchen watching TV, all right? But, we have Dr. Horacio Arruda, right, National Director of Public Health, who is also Deputy Minister at the Ministry of Health and Social Services, right? I don't want to go through, his bio, because I'll be taking too much time from his introduction, from his presentation if I do, right? But suffice it to say that Dr. Arruda has been, interventional epidemiologist and preventative health expert for a good number of years. And I'm extremely ecstatic that during the current circumstances that we're in, he was generous enough to give us his time this morning and come and present. So thank you very much, and the floor is yours.
Thank you. Do you hear me well? It's okay, or do I need to put it? It's okay this way? Good morning, everybody. Bonjour, bon dia. I'm very happy to be here, really. I would say, first of all, that for me, the next generation is very important. You're going to do best at what we did. You are more informed. You are aware of the different risks that are happening in the world. So thanks. It's for me a pleasure to have the opportunity to discuss with you. I will try to make my presentation as short as possible, but as I'm here to present something, and I would like to have a good exchange with you, because I think it's important to have your point of views. First of all, I'm a doctor of a population, and as you know, a population is not homogeneous. There is different groups, there is different cultures, there are different ethnicities, there are different values and everything, and that in a pandemic we have seen all those aspects of life. There is a lot of things to study in the perspective of sociologists anthropology, and everything that you study here. I don't know what is your background and where are you going, but you know, there is no one who has the right answer. Even the doctor, there is a need to effect that when you do something, there you are. You know, there is impacts that are going to be lasting for years around what the interventions we made for saving lives. At the same time that we want to save lives, at the same time we are attacking, I would say, the autonomy of persons, and that is not something easy to do. And you know, in medicine, I always say to myself, first of all, do not harm, because your treatment must be better than the impacts of your treatment. But at the same time, it was a very, very complex situation. I can tell you that as a public health doctor, I worked a long time ago for having this law of public health, trying to protect it. I will never thought I would use the urgence sanitaire, the emergency, for more than 20 months. For me, it was something that could last for 3 months. I would never tell you that I could think I would do a curfew or recommend a curfew, which is an attack to rights of the person. You know, we are not in war, but we were in war against that virus, and that is something very important. And I was not also thinking I will never use the that we did for healthcare, because this makes some tensions in between groups. And I think, finally, before doing my presentation, I want to thank you, because I will tell you, when a doctor prescribes a medication and the patient don't take it, it won't work. And I would say that Quebec population, all groups have done a wonderful work, respecting, I would say, and keeping our society in a good balance. But it was difficult, it is, and I want to thank you for all the sacrifices that you've made. And I think, I will tell you, always people are talking about youth as a problem. For me, youth are the solution. I can tell you there is elderly people who had more difficulty to observe the things than youth. So and you're going to do better than I do. I hope so. Next slide. Okay. I would just, it's a word crisis, just some numbers, okay? From December 19 to October 2021, it's a 20 months long crisis. And we tell you it's not still finished, and there's going to be impacts of this crisis that we will have to take into account for a long time. But at the same time, there is wonderful things that happened during this crisis. Things that we developed, like working at distance, different technology that would have taken, I would say, months or years to implement, have been implemented in 3 weeks. So in this crisis, there is always an energy, and we must always find a place where things are going to be opportunities. It's very important to take that in mind, because if you don't think that way, you're just going to get discouraged. You will have difficulties. There is a rapid spread through the world, new information on the virus every day. We are now at the 4th wave. There is you heard about this. And I would say to you something, my first press conference on March, I told what is true today may be different tomorrow, because I would tell you, we were learning every day about this new virus. And even if people think that science was slow, it wasn't slow, because in fact, compared to 10 years ago, we could have not have a vaccine or even had the genetics components of this virus in only some weeks. So it's a tremendous work of different researchers around the world. And I know that the media is going to tell me that I didn't want masks, that I recommending it and even wearing it every time. That's part of the reality of the risk management that you must take into account. In Canada, the first case 2020. In March 8, the first death. In Quebec, the first case was in February 28. It was a back from Iran who bring the disease in Canada and was detected. In March 18, we had our first death. Up to October 22, imagine there is 4.9 reported, and there is probably more than that because not all cases are reported. 243 million cases. You see the numbers here in Canada and the numbers of death, almost 12,000 actually in Quebec. But when we compare our deaths to other provinces, other countries, we really have extra, I would say, we consider anybody who dies from a disease that could be something else, but also with COVID as a COVID case, which is not always the case in other countries. So it's very complicated to compare death rates from one country to another, from one province to another, because the different systems are sometimes only with some studies made later about surmortality that we are able to make some comparison. Here, oh my God, okay, here, because I'm doing both things, you know, I'm like a woman, I'm able to do that, two things at the same time. It's not the Russian, how do we say that, montagne russe, it's the epidemic. In the first wave, you know, in March, there was almost cases in elderly persons, okay? Then you see the second big wave, the third wave, and the fourth wave. So we have now cases, less mortality comparing to what that's the first wave. You see the high mortality here, which was in CHSLDs and the community. You see the second wave with some mortality, and then you see when we really implemented the vaccine, the effect curve of disease, and I would say also from dying. We use a lot of numerous sanitary measures, personal basic hygiene. You can see that in your hands. I repeat that, and I did repeat that. Dancing, which was very, very important because it was not known if the mask was smaller gatherings. It's, you know, it's a big decision to take, and there is impacts on that. Owners who were crazy, depressed, or even could have suicide. We don't know, but the rhythm of suicide didn't go up, but the rhythm of depression and stress is very high. We made limitations of social activities. You know, remember those confinements. Work, you knew that. I think you have been exposed to long distance learning. Be together here in class to see our colleagues. We had put masks and curfew, imagine. Just perhaps about the impact of the epidemic. There is an enquête québécoise de la santé de la population. It's done every 6 years by l'Institut de Statistique. Made to take some measures on the life habits, physical and mental health status, and some health determinants. So I will show you some results. One loneliness, about Quebecers 15 years old and more, 19 were often under impression of lacking company, I think was a problem. 18 often felt isolated from, and 10% often felt left aside. So that's self-reported, but that's worse than the period before, and we'll see the follow-up on that. About certification, regarding 77% of Quebecers, I'm sorry, I'm late. I'm changing it and don't see it. You just say me, hey, change the diapo, please. one regarding social life, 77% of Quebecers consider that regarding their social life has decreased since the onset of pandemic, with on women compared to men. People under they were in a back working from home felt it more difficult. One of the feelings associated with emotional distress, for those that show a high level of emotional distress, to associate these feelings entirely to the pandemic. This proportion is the same for men and women. The persons that were more likely to associate their feelings of emotional distress to pandemic were those that experienced in meeting their financial obligations, and it's one of the reasons of the different financial programs to help people to go through this economic crisis. Living as a couple with children find them very distressed. Even work at home with kids was sometimes not an easy way to do. We love our kids, but with us all the day when you are at work and in Teams meeting and everything. Even the cat is sometimes a problem because the cat wants to go to the screen. But at the same time, without our cats or dogs, it's very difficult to go through. I can tell you, if my wife and my kids were not there, I would find it very difficult. And if there was a tension in between us, it would be difficult to do our job because we got a lot of tension every day. The persons who also that consider themselves as having an excellent that depression mostly to the pandemic, because the other ones are sometimes mental health issues. There is another survey here that has been done by the Institute of Public Health. I will just show you some of the results. I don't want to read them, but in fact, this is done every week, and to monitor our patient, I would say, we do some inquiries or sondage, which are not always representative, but at least it gives an impression of what are the opinions of the different actors. 83 are in favor of sanctions for those who caught frauding the passeport vaccinal. 77% at favor the passeport vaccinal to get access to sites and activities. 76 fear may be overloaded with COVID-19. 71 fear the numbers of cases will increase should a new variant occur. 70 are sanctions for those who will not check vaccination status for their clients, and 65 feel that the PV should be presented to access more services and shops. In fact, and here you can read it, and you will probably have the presentations if you want to have those numbers or files, or you can go to the site of the Institut National de Santé Publique to have different reports on the feeling. But I would say that majority of the population in Quebec have been really good persons listening to things. And we have sometimes the impression that the against ones are bigger, but they are very vocal. And there is also all the phenomena of that is something in the context very interesting to understand the way people act and interact with social media. So, next slide. We had some specific actions to counteract the effect of pandemic on mental health. I just want to say that this doesn't look like too much in the public, because we didn't discuss that on press conferences. We were more in giving people the advice getting the disease. But there have been a lot of actions, especially to detect the effects on mental health, economic systems, or deteriorations on mental health. In November 2020, we announced an investment of $100 million to maintain measures implemented during the first wave, which is to improve some scouting teams in communities. I will explain. Speed up digital strategy on suicide and reinforce our line of suicide to detect any issues. There is a scouting team project. It was built in the strengths of the communities. It was based on a positive effect after the Lac-Mégantic tragedy. There was some people that have been identified as scout teams, and they come from different organizations, but they got the mandate to make and detect people with health of isolation, deterioration of the disease, and it really creates a network in the community to be, it's better also when ethnocultural approach to have the community to understand and communicate for different reasons, cultural or there is sometimes no confidence with the healthcare system. When we talk about First Nations also, because of the trust, because of the history of our relationship with them, sometimes it's difficult. So it's very important to work in collaboration with the groups, with the people, and to adapt approach to that ethnocultural, because it's not even language issues, the way using radios, using even people from the community to help that. We also adapted the strategy about suicide. A lot of, I'm sure, and most of the time, even now, we are a couple and we are with our phone and not really talking. So we must adapt. We have in contact with, I would say, the youth and even others. And so there is a new strategy to offer a 24/7 helpline through chatting and SMS. So this is something that has been implemented before, actually. Even if there was an increase of call in 1-866 appel line, I think there was people, perhaps an hour, trying to get information on suicide. At the same time, the coroner study doesn't show an augmentation of deaths by suicide, which is a good news, but there is a lot of stress and other aspects to take into account. There was also different programs to help in schools to help people to manage their emotion, manage their sadness. It's very important to begin those things very young, because we know that there is determination which are related to the way you are in interaction society with others. So there is a lot of programs actually trying to address the effects of violence. And I would tell you, probably some kids have been suffered when we were in the curfew and confinement, because the school helped them to have even sometimes some food. There has been a lower rate of declaration on the DPJ, Direction de Protection de la Jeunesse. So I'm sure, and there was a lot. You see what happened with different feminicides here in Quebec. So this is side effects, I would say, that makes that the factors that are there are going to be emphasized and will generate more problems. I think the actions of different groups are very important to go at the vulnerable groups, including disadvantaged population. There is in public health a principle which is very important, because even if we are a good society, better indicators of health, there is, I would say, lower income, lower people who have inequalities to health. It's clear, it's still the case when you are on the east part of Montreal, your life expectancy is 7 years less than you are in the west part of Montreal because of different factors and different determinants of health. And this is very important to take into account because there is specific, I would say, regions or even communities which could be ethnocultural, which could be socioeconomic, that are in different socioeconomical conditions. So there is a need for social integration, access for service for everyone, and to take into account the ethnocultural context. So there is always different actions that have been made, which was in relation to translation of information and in way of giving the information. We had to collaborate with different partners. We have to use translator services. And we have also to adjust our message to the outbreak in order to avoid information that could be regarded as being racist or stigmatizing. You know, it's important to explain to people the risk factors, but it's very important to be careful in the way that we communicate the data. I don't know if you remember, at the beginning, Chinese people here were ostracized because what happens in China, and that can make tension. You know, the fear, I told you, and I told that in a press conference with a problem, that the word that I use, that fear makes people make crazy things. And even very intelligent persons in the crisis will do that. And, you know, imagine when we say that you must work and have the information of the different ethnocultural places where the risks are higher, not because they are ethnocultural, because of the way they are in their determinants of health, poverty, sanitation, and everything. So it's very important to not discriminate these groups. At the same time, we want to help them, but at the same time, it's very important the way you communicate those issues. Furthermore, certain regions have seek close collaboration with First Nations and adapted the nature of their action. Actually, there is a high outbreak in Nunavik, and we must adapt the approach to Nunavik, which is very different. And the coverage now over there is 49% only. So it's very, we will not do the same thing there than we do here in Montreal or in other places. You have to adapt those interventions. So there is different, I would say, approaches that have been made about those different groups. Action regarding religious groups. This is very important. Is religion essential services or not? That depends on your values, you know. And for some, the religion, independently of the religion practice, it's also a community. It's also social services from their church and everything. So it was not an easy question. I had to discuss, and we get inter-religious table, which was not one religion against another, but all the religions tried us on the impacts of the epidemic. It's clear that mass and singing in church is a risk for epidemic. So we had to manage that, but trying to find a respect to that need of the population. And I would say in a more laic society like we are sometimes, we minimize, I think, the importance of religion for certain groups, and I think it's important. And working with the leaders of the community, for me, is very important, because they are the ones who the people have confidence to. And I think that if we are able to work together, it's a better way than making opposition. And we must adapt. And not every treatment is the same from everybody, you know. We want to be just and equitable, but equity doesn't mean necessarily equality or the same thing. It's something difficult to understand and to explain, especially in the context of media, who people try to find out some problems with those very complex issues. So we had different, as I was telling you, in generally, we try to work with them and solutions to the problems that we have been expected. Well, because I think now that was and I could pass hours about epidemiology and different things, but I think what would be more interesting would be to discuss together, and I'm happy to see that we will have time. So it's a long-lasting pandemic. It's not finished. I'm sorry to say you that. We are in a better position. Vaccination is a clue for helping us to do that. Even if there is some people who don't believe on vaccination, I think it's clear that it's helping the world. We have the opportunity, comparing to other countries, to have access to vaccines. You should understand that if we don't vaccinate those countries where there is a lot of transmission, there is a higher risk of a new variant coming here, and then the work will be, perhaps, we don't know, to begin again, especially if this new variant will not be answering to vaccines. For public health, mental health is an important and as important as physical health. I'm sure there is a lot of elderly people who were confined, who really were not enough stimulated, and they probably degrade their physical and mental situation because of the pandemic. At the same time, we wanted to save their lives, but how do you balance those issues? It's not easy. I hope we will never have to come back to that kind of approach because of the side effects. And I think that we will have to work and live with COVID-19 as we do with influenza each year, who kills elderly people because they are at more risk. But we cannot control an epidemic to have 0 cases, and I think we cannot stop society working as we did. But it was the first big pandemic of coronavirus since the SARS first one across the world. So everybody was, I would say, almost in the same boat with different contexts, cultural contexts that are very important. We have public health concerns for various age groups, including the youth. The impact on school learning, stimulation on kids are going to be followed in the next years. Ethnocultural communities, which is related to identity. It's very important, your identity and how you can understand that. And in this, I would say all the social sciences are important to understand the phenomena. There is no only doctors on that issue. That's a society issue, and that's a communication issue, and that's an anthropologic approach that are very important. We must work with minorities because they have often less favor in determinants of health, economics, social life, and we must take into account religious groups and beliefs. All this is part of some things you study, I'm sure, here in that college. So risk management is a difficult balancing act between benefits for community against disadvantage for the individual. I would tell you, I've got an image, I didn't bring it here, but it's a guy with a pole in a very thin cord between 2 big buildings in New York, and you're always trying to get the equilibrium. And if you go in that way, there's going to be problems. And if you do that, some will say, no, I'm not happy with. And if you do that, some will say, no, and I'm aware of it. It's a very, very complex situation. But I think we must keep in mind our objectives, what we want to do, try to do our best, and adapt to new information about this. And now I would like to hear about you. Probably you can give me some advice or talk to me about the way you have gone through those 22 months. And I wish we're going to be able to come back to a normal life, travel again. I'm sure I'm going to take the airplane. It's going to be like my first airplane because everybody missed that. And I hope we're going to have a good, I would say, period de fête to be together. So it's a pleasure to be with you. Please tell me what to do. And if every ideas is good, but also tell me the way you live this situation. Thanks.
Thank you very much. Okay, folks, so this is the opportunity, an incredible opportunity to ask Dr. Arruda any questions you might have. I'm sure he's entertained very tough questions over the last 22 months, so any type of questions and concerns you might have are welcome, right? So let's get
and even you can insult me, I understand. You can ask me things that you didn't like. It's important to understand that, you know, not only when things go right. I want to hear about you, and you will not lose any point on your exams because you ask a bad question to Dr. Arruda. You know, I'm used to it. You cannot be worse than journalists. And if you're going to be a journalist, it's very important. You know, I believe in democracy. I think when the journalists cannot talk about the situation, it's terrible. We have the opportunity in our country to be in a democracy where people can express and not be afraid of getting killed. This is great. This is important.
Okay, the first question here.
So I just had a question concerning how there was an effect on the people that didn't necessarily have COVID at the beginning of the pandemic, that they had to succumb to like the lack of like resources in the public health system, and that they ended up being a casualty of the pandemic without being a specific victim of COVID-19. Was there like, will the Quebec take an accountability for those lives that were lost, or will that just be just casual lives that were lost, even though there was lack in the public health system and it caused that a lot of lives were lost that weren't even related to COVID-19?
Okay. I hope I understand well your question, but in fact, it's clear that there is not enough money. I'm from prevention part of the system, so I'm talking to my, but there is, you know, the nature is not preventive. The nature is react to what we get right away. And it's always been a challenge everywhere in the world to keep investments in healthcare and prevention. So, and why? Because also the population wants to get treated. They want to have new medications, which will be perhaps okay for one person, but when you look at the cost for the population, that's not rentable. You know, we got vaccines that we can put into the programs actually, but we don't have the financing because we are financing emergencies and new drugs and everything. But your question was specifically against the ones who were not. Could you repeat about COVID-19 versus the one who didn't have COVID-19?
It was the people that were in hospitals that didn't get the treatment because there was so much concern about the people that had COVID-19. So like cancer patients or people that had like pre-existing health issues. Okay,
this is one of the collateral effects. In fact, this is going to be used and studied in prospective studies when we're going to compare the rates and of people dying from cancers not treated at the right stage. We try, I would say, to keep that as lower as possible. But I don't think in a complex system like ours that it didn't happen. And this is one of the effects of collateral effects of having close services and keeping services in the situation like Italy when there was intensive cares that were overwhelmed with that. But that's something to be analyzed and researched. Very good questions.
Okay.
Thanks. Hi, it's quite an opportunity for all of us to have you here today, so thank you again for coming. And my question I want to go back to the idea of perceptions that you mentioned early on in your talk, and that most Quebecers seem to support most of the healthcare protocols that you put forward, or that the government put forward, but not all. So as you identified various communities, ethnic groups, religious groups, and youth, what about that group? The group, could we say that there is a group, that there's an identity around a group of people that are more resistant to healthcare protocols and also resistant perhaps to the vaccine? How do we reach that group?
That's a very good question. There is not a perfect answer, but I think the first thing is to understand what are the motivations of those persons. You know, some it's fear about, so you can, and it's very important to understand where is the person in their process. You know, we call it the motivational approach. We understand. If somebody, first of all, an anti-vax really for years is someone that we're going to put a lot of energy to bring to vaccination. It's going to be almost, but there is all those persons with hesitancy that for different reasons. So we must understand very well what are their motivations and try to communicate most of the time with people from their community. Because Dr. Arruda, even if Dr. Arruda says that, if your beliefs, your values, if your approach in medicine is completely different, you must try to inform in a respectful approach, most of the time helping with groups in their communities, people that they're going to trust to, you know. Just an example, in the religious community, recently, a very tough one, I would say, that were anti a lot of measures. The principal leader have been vaccinated and is now explaining, you know. So it's an approach that is more longer, but we must understand very well what are their reasons. If it's fear, you must lower the fears. If it's a problem of trust with the system, you must address that with alternatives. And sometimes you won't get your final object, but we'll have some steps. They will accept some of the measures, even if it's not all. But it's complex. It's complex, and there is no perfect solution. And one community is not the same approach with the other one. It's why it's important to also work with the organismes communautaires that are in the field for years, because they understand those persons, and you can find leaders in those communities. Trust,
Some hands
very
down
important
here.
thing, trust.
Okay.
Good morning. Thank you for taking the time to speak with us. We
It's a
really
pleasure for me.
appreciate
I
it.
can tell you it's better to be here than in some meetings I have.
I can relate. My question has to do with your background as an epidemiologist. Is there such a thing as being too sanitized? Like, you know, germs are good to some degree, no? That at some point that all of this sanitizing is going to not help us build immunity to things? It's something that not a lot of people have been talking about. I just would love to hear your take on it.
Yes, you know, I'm not the kind of person who kills 99% of the germs everywhere. No, it's like too much is not enough. Okay, but I think that just an example, because of our confinement, but also distanciation and also the masks and everything, we had almost no flu last year. And almost no, I would say, gastroenteritis in Christmas time. And we know that it happens most of the time. You work all the fall, you're tired, you arrived Christmas time, you relax, and then you've been attacked by all the microbes and viruses that your kids can have. So there is a balance on that. I think it's important to get stimulated, but there is some germs which are more difficult. COVID-19 is a bad one for elderly person, you know. So I think it's a balance. But I think I believe on that, and I'm sure for me vaccination is a normal, natural approach, even if it's scientific, because you stimulate your immunity with a virus or part of the virus which is not, I would say, dangerous for getting the disease. There are some side effects and everything like this, but I think that's a balance. I would say if your hands are getting red because of too much hand washing, there's going to be risks of sewer infections on your, so balance it. You could, it's probably more the eye touch places where you put your hands that you must do, and even not disinfecting everything and not having the Trump recipe of drinking disinfectant. That's not the good way.
It was more a general question, not so much to do with the virus itself, but just in general, right? Just over-sanitizing.
Yes, but I think, but the issue is that there is beginning diseases, but there is ones, especially for young kids, that you can go to hospitalization and even die from that. So it's a balance, I would say.
Bonjour, monsieur Dr Arruda.
Bonjour.
Merci d'être avec nous ce matin.
Ça fait plaisir.
J'ai une question pour vous. Je vais un peu diverger de la pandémie, mais ça a quand même un rapport.
Il n'y a pas de problème.
Donc, j'aimerais juste savoir, donc la CAQ récemment a présenté le projet de loi 21. Pensez-vous que si cette loi n'avait pas passé, on n'aurait pas, si on revient à la première question, on n'aurait pas eu autant de problèmes à avoir des soins parce que cette loi brime certaines personnes, certains médecins, certains professeurs à travailler dans leur secteur? Et aussi, êtes-vous concerné par le fait que ces mêmes personnes vont jouir d'une belle éducation à moindre coût au Québec, aller travailler dans les secteurs privés, publics, dans d'autres provinces et d'autres pays?
C'est une excellente question. Mais le directeur national n'est pas le sous-ministre adjoint ici devant vous aujourd'hui. Je vais vous dire très honnêtement, j'ai pas étudié l'impact de la loi 21 en termes de chiffres scientifiques. Fait que je peux pas me prononcer. Et j'ai un certain devoir de réserve comme sous-ministre adjoint. Mais comme je n'ai pas fait l'analyse, si j'aurais fait une étude puis que j'aurais pu être capable de démontrer, j'aurais pu en parler, mais je suis pas en mesure. Mais c'est sûr que chaque intervention crée des effets pervers. Maintenant, il faut voir quelle balance les gens font, mais je me fie sur la démocratie pour essayer de régler cette question-là.
C'est peut-être une question pour the political scientists, the sociologists, the anthropologists, to see what the effects of legislation does on confidence of certain ethnocultural communities and minorities.
Right? And there is public policy that have impacts.
Oh.
Hello, Mr. Arruda.
Hello.
Yeah, I have a question that I wrote down here. So my girlfriend had a big struggle through the first, second, and even the third wave of the pandemic regarding spolitude-related activities. For many months, she would have literally died to have an opportunity to ask you personally, Quebec's Director of Public Health, why she couldn't practice her sports in CEGEPs while high school spolitude programs were fully allowed to practice their sports. For me, this issue sounded very prominent during the months of the pandemic, but this might be simply because of my sport-related surroundings. So my question is, how have you dealt with, during the highest points of the pandemic, the pressure and opinions of putting these restrictions on higher education athletes?
Could you just repeat slower the last part? Je suis vraiment désolé.
So my question is, how have you dealt with, during the highest points of the pandemic, the pressure and opinions of putting these restrictions on higher education athletes?
Oof. You know, I'm not alone. I've got teams. And every decision we discuss is look at from one side to another one. And we then come with a recommendation, and we present them to the authorities, and they look at other aspects that are going to be put into account. So it's always that process of, at that day, taking the decision that we think will have a better impact with the less effects. But knowing there is effects, and every time you do something, there is going to be somebody who would say, not us. Why not us? And it's like also some decisions that looks not coherent. They are, but they look not coherent because people perceive they as the same. It's like the bars. The bars are a place where there is outbreaks. There is data telling that. But when we compare different aspects, theaters to bars, it's not so simple as it seems to be. But it's clear we're creating some inequities. And it's clear sometimes it doesn't look coherent, so you have to manage it. And you always have to keep in mind why I'm here, why I'm doing that. When I do that, what is going to be the good things, what's going to be the bad ones. And there is a decision to be taken. You cannot wait. If you wait too long, there's going to be a problem. So it's better to readjust if you made a mistake, and even say it's different from yesterday because there is new data. That's the way we did approach that. But there is a lot of input. It's not only, there is no so much evidence-based. It was not written in the books how to manage SARS-CoV-2 and what did UK did, Israel, or United States. It's not the same society. It's not the same values. So you must try to do your best. And if you don't, man, there's going to be different inquiries I'm going to have in the coroner and in all those commissions that are going to come, which will be, I will probably finish my life in commissions.
Thank you.
I'm going to come back to you guys after this one, okay?
So Ontario has already released dates that they're gonna, when masks are not gonna be mandatory and vaccine passports, and a lot of people are saying that this is premature and that they shouldn't have released this date. So I want to know your opinion on this fact, and as well as, has Quebec even considered releasing dates like that, or do they think it's too premature?
Just the last phrase, I'm sorry.
What is your opinion on Ontario's plan to remove masks and vaccine passports? Do you think it's too premature? And has Quebec considered making a plan like this and releasing it?
I think we will consider to have a plan for taking away, because the passport vaccinal is a temporary approach, and masks are also. I think we would probably try to keep masks, not forever, but as part of the hygiene, respiratory hygiene. There is different societies. You've got flu. You're going to see your grandmother. You don't want to infect her. You can perhaps have a mask. This will be a normal approach. But I think actually, before we get vaccinated, the 5 to 12 years old, it's perhaps too premature to stop those measures. When they did it, things are going up. Actually, in Europe, things are coming up, actually. So I think, and one of the problems that we have actually is not necessarily the number of cases, because even if there is a lot of kids, they are not going to hospital and they are not have side effects. There are perhaps some who are going to have long COVID. We don't know exactly, but it's our healthcare system. Our healthcare system is very fragile. People are tired. People are pandemic fatigued. Even when they think about a case of COVID, they get crazy, So we have to protect that thing to get access to the ones who want to be treated for cancer and the ones who want to be treated for heart disease and surgeries. So I hope by 22, or even there is going to be more and more, I would say, liberties announced soon, but with the vaccine passport, because the non-vaccinated group are at very high risk of getting the disease and transmit them to even people who have been vaccinated.
Bonjour.
Bonjour.
Vous avez parlé des investissements puis des approches prises pour la santé mentale. Ma question, c'est est-ce que vous avez des plans pour faciliter l'accessibilité à la thérapie? Et pour le gouvernement, par exemple, dans
Oui.
le système du...
À la psychothérapie, par exemple?
Ouais, exactement.
Oui, oui. Il y a des investissements qui ont été faits, là, puis il y a un processus actuellement pour augmenter le nombre de psychothérapeutes dans le système public et non pas le privé. Je n'ai pas les chiffres exactement, mais il y a eu plusieurs millions. L'enjeu qu'on a beaucoup, it's not only, ce n'est pas seulement un enjeu d'argent, c'est d'avoir des ressources humaines. You know, even if you get money for paying them, if you don't have the human resources because they have not been formed, you know, it takes must have at least 5, 6, 7 years to have a psychologist to be formed. So it's always difficult. And we have, before pandemic, a crisis of human resources in all sectors, and that's the case actually. But there is investments, and there is more psychotherapeuts, and also different types of professionals that can go working in mental health.
Oui, bonjour.
Bonjour.
Oui, donc pour reprendre la question de ma professeure qui dit qu'il y a un groupe qui vraiment est contre vouloir prendre le vaccin ici et ça et prendre les mesures, si vraiment ce groupe, on n'arrive pas à changer leurs idées, changer leur mindset, est-ce qu'on va rester dans cette pandémie-là genre pendant tout le temps ou est-ce que genre il va juste partir ou il va...
Bon, heureusement, au Québec, les véritables contre la vaccination ne sont pas si nombreux. Okay? Si 50% de la population était vraiment contre la vaccination, on aurait des problèmes. Au Québec, on est une des sociétés qui a le plus haut taux de vaccination à travers le monde, avec le Portugal, etc. Parce que culturellement, les gens, dans l'ensemble, sont pour la vaccination. Quand vous allez en France, il y a énormément d'homéopathie, de médecine naturelle, etc. Les gens sont déjà au départ, ils n'obtiennent pas des couvertures vaccinales élevées. En rougeole, par exemple, leur couverture vaccinale est catastrophique. Ils ont des épidémies continuellement. Donc, je pense qu'avec la vaccination des 5-11 ans et peut-être des plus petits antérieurement, on va avoir une immunité, s'il n'y a pas de variant, il y a beaucoup de si, là, qui va être collective, qui va faire que le virus va probablement devenir endémique. Ça veut dire qu'il ne disparaîtra pas, mais il va attaquer de temps en temps les gens qui n'auront pas été vaccinés, ou il va finir par disparaître. Ce serait le meilleur, parce qu'on n'aura pas besoin de revacciner les gens. Mais au taux où on est au Québec, et je pense, et c'est impensable, even if it's a dream for me, même si c'est un rêve pour moi, 100% de vaccination est une utopie dans les sociétés. Depuis le début de la vaccination, il y a toujours eu des gens qui ont été contre.
We have a couple hands here. Okay.
Bonjour, Monsieur Arruda.
Bonjour.
Je demande une question en relation avec une question qui a été demandée tantôt. En relation avec les mesures de santé publique, qu'est-ce que ça va prendre pour quelque chose de clé ou de sujets clés dans le département de santé publique pour arrêter les mesures publiques? Est-ce qu'il y a quelque chose de spécifique qui doit arriver dans la société québécoise pour que vous et vos collègues vont décider de cesser d'utiliser ces mesures de santé publique pour protéger la population?
C'est une bonne question. Il n'y a pas de réponse simple. C'est pas un chiffre. C'est pas un chiffre, c'est une série de facteurs. Quand on va être en situation où on va avoir probablement vacciné une bonne proportion de la population, hein, notamment les jeunes enfants, parce qu'actuellement, où sont les éclosions? Dans les écoles. Pas dans les cégeps, pas dans les universités, pas dans les écoles secondaires où le taux de vaccination est élevé. Il y en a quelques cas, c'est vraiment au primaire, là où les enfants ne peuvent pas être vaccinés. Quand on va avoir vacciné ça, espérons-le avant Noël, si le vaccin arrive le 15 novembre comme prévu, là, on va avoir une plus grande, je vous dirais, immunité collective et on va regarder l'impact sur les hospitalisations, puis etc. Puis là, on va revenir à la normale. Je prévois ça, là, je veux pas m'avancer parce que les allez me dire, il a dit telle date, puis c'est pas ça qui est arrivé, là. Mais il va y avoir de la liberté.
Il n'y a pas de journaliste.
Non, c'est pas grave. Mais il y en a peut-être des futurs ou qui ont des contacts. Ça vaut la peine, c'est 1000 $ de l'information, hein, je peux vous dire ça, là. Moi, non, mais quand on va avoir un équilibre dans la transmission, à ce moment-là, on va pouvoir relâcher et je vous dirais, puis on va relâcher même avant ça, là. On va relâcher d'ici quelques temps certaines choses. Vous allez voir, le monde va pouvoir notamment faire certaines activités qu'ils revendiquent dans les rues. On va pouvoir le faire, mais on va suivre la situation, puis peut-être qu'il y aura des approches plus régionales, tout dépendamment de la couverture vaccinale qu'il y a, etc. Bon, mais ça s'en vient. Faut pas lâcher, parce que nous aussi, hein, on est tannés.
Bonjour.
Bonjour.
I just have one question. So in the previous year, the academic year, I remember it was a huge problem with a lot of families that primary and secondary schools were allowed to go to school in public, but for CEGEP and university students, it was basically just online because of COVID restrictions. What was the thought process that went behind that decision, and do you think it was a responsible decision?
Could you just repeat the last?
What was the thought process to send secondary and primary school kids to school in person, but not for CEGEP and university kids? And was that a responsible decision?
Okay, first of all, one of the factors we decided in Quebec was that education is a very important one, okay? Kids, younger kids, the first years are very important to their development, okay? Not only, I would say, for academic perspective, but also socialization. And in fact, a lot of pediatricians, as the kids are not so sick about the disease, were that we try to make the more normal life to kids. So it's why, even actually if there is outbreaks in primary school, they are coming back to school, because 1 year or 6 months is something, but 2 years, there is a risk of problems of development, social, and this is very important, even in younger ones in kindergartens that we keep open most of the time. The benefits from the socialization and being in a more normal life, and even for their mental health, and even for their protection, because there is sometimes those schools or kindergartens are protective things for vulnerable populations when there is violence or even no food and everything. So that was the decision that was taken. And I know that some parents were very anxious because they were afraid. But at the same time, I'm sure that if we had maintained kids at home with tele learning, will that create a lot of academic problems and social problems for the future?
Hello. So my question was aimed more towards what you said in elementary and high school. So we know that the younger kids couldn't go to school for a big period of time, and that affected them psychologically and physically, considering that they couldn't do any sports or anything. My question was more aimed towards how are you going to do in the future to make them more social again, because a lot of them, because of technology, they got exposed to it way younger. I'm talking about more like kids like 5, 6, 7 years old that couldn't go to school, so their parents just gave them an iPad and just let them go on YouTube. How do you deal on making them go out and play sports again and instead not stay on YouTube or TikTok or whatever?
It's a very important question. And you know, we had a forum, Dr. Karma, I was not there because I was with COVID-19, about screens and health. And there is a big problem, even for adults, getting dependent. You know, when I don't have my phone, I feel nude, which is not normal. I'm very dependent on that thing. I don't know how come I let it here, because most of the time it must be here to make sure that I don't miss anything. But there is effectively programs that were going to be put in place and some, I would say, recommendations from experts to parents to really balance. I think it's impossible to say no more screens anymore and come back to before, but at the same time there is a need, and there is a need to also promote with the politique gouvernementale de prévention de la santé good habits, sports, and everything. I think there is a need for that, and there is conditions, not only put the pressure on parents or kids, there is conditions in schools, there is conditions in municipalities to give the opportunities of the kids to share and do that. There is the approach with Pierre Lavoie, and there is all kinds of, I would say, other things than infectious disease, because public health is not only infectious disease. It's health promotion, it's good habits of life, it's the way we prevent mental health. And when you do sports, you are in a better shape, you are in a better mental aspects, and you can prevent even things like Alzheimer and everything, and cancer. So that's the approach that we want to try to promote with the new generation. But it's not easy. It's not easy.
Okay, do we have any other hands anywhere? Okay. All right. I'm going to do my disappearing act and come back.
Oh, he disappeared and appeared there. He's a magician.
Hello. Thank you so much for being here.
It's a pleasure.
I was wondering, referring to the part of your presentation about acts taken to improve mental health and suicide prevention, you mentioned that it wasn't talked about at press conferences. And I was wondering why it's not talked about at press conferences if you're funding them for more people, but then not talking about it to the Quebec population.
Well, that's a very good question. We talk about mental health. We did some information, but it was not the place there to talk about the investments of the government and everything. And we work with our public health teams and our mental health réseau that make that information available. But perhaps you didn't hear about it because it could happen. It's not always the case, but there's going to be, and there's going to be a lot of communications and I would say plan to that. It's clear we were in the crisis. We were, and there was a lot of issues. We cannot treat everything. We had to focus on 2 or 3 messages for press conference, because if we treat everything, nobody won't understand what we're going to do. So that's the way we did it. But there's going to be more promotion about this. And there's going to be also in the field people working with schools and parents to help them, to give them the tools necessary to have an equilibrium in their life, sports, mental health and everything. And to detect problems with kids also that can have mental disease.
Okay, there was a hand a little bit lower.
I will
down.
have only 4 minutes because I'm sorry, my Prime Minister
Yes.
is waiting for me by 10.
One more question.
I've got a presentation to do to my Prime Minister. I could stay here. Could I call him and say, I'm not going, I'm going to stay with the kids, with the friends? I'm sorry, I call you the kids because I feel old when I went to college. It's a long time ago.
Good day, Dr. How are you?
Very well. Happy to be here with you.
Amazing. Before the pandemic, nurses were already raising issues about their work conditions and salary. During the pandemic, obviously, those were increased. And now we're putting a lot of pressure on them to get vaccinated and to do overshifts. And that has led to a lot of nurses to just quitting their passion. Are you concerned about the health system now that they are the pillar and they're leaving their jobs?
I am. You know, I am. And yes, I am. I would say that, well, first of all, normally, when you work in science as a healthcare worker, you're supposed to, it's a privilege to protect your people. Bon, there is health and beliefs on some others that don't want to have it. We did that mandatory vaccination in a period where there was a lot of cases. There was problems because we want to protect them too, because they are part of the workforce, and we know that they are the ones who get the disease. So that was a difficult, I would say, decision to take. Now we see how the government is going to manage the operational aspects of that. That's all, and I told you, it's not at all what I do as my first decision, because I would never accept to do mass immunization of other sectors than healthcare, because I don't think it's the right way, because it makes people in polarity, and and even now there is issues that people who are vaccinated don't want to work with people not vaccinated. So this is something dangerous as a tension. I hope it won't. I hope it's going to help next healthcare workers to understand that if they have to go in healthcare, they must be vaccinated, but not polarize and lost our gains, the good confidence that the people has on their government and public health about vaccination. That was one of the dangerous decisions.
All right, so we're going to wrap things up.
I just want to say to you, thanks. You are intelligent. Nobody insult me. I don't know why. Perhaps you can do that in social media. It's a place to go, but I don't go to social media, because if I go to social media, I can be depressed. So, and I want to be in good mental health to try to do my best for you. And you are the future. You are going to do a better job than we do. I hope so. Thanks.
In your in your future college comes up with people, you can tell them how nice we are and that we didn't insult you and we didn't invite journalists. Vraiment sérieusement, par contre.
I love journalists.
I know.
No, really, I think that sometimes they make me, they ask me questions that are tough, but that's their role. Democracy. Don't forget that.
Et pour en finir finalement, mais encore une fois, on est ravis de vous avoir reçus et accueillis, puis on est ravis que vous ayez accepté en pleine pandémie de passer cette heure et demie avec nous. Dr. Arruda, merci.
C'est une thérapie pour la santé mentale. Ça fait du bien d'être avec vous. Moi, ma femme m'a dit que ça allait me faire du bien de parler à des jeunes. Alors, au plaisir.
Merci.